These are a little late. It's going to be this week and next week. I'm doing them all tonight. Esther has been crazy, and I know you guys have been really feeling it too. So I'm sorry that this is a little late, but I hope that these, I'm going to do one for hepatitis, one for pancreatitis, and then one for like the bowel obstruction stuff. I hope they're helpful. I hope you guys are doing well. Okay, so hepatitis. I know you guys had a test on this already, but it's just a little more review for your final. I'm sorry, my glasses are in the way. Ugh, I'm so tired. Okay, so hepatitis. So hepatitis is just inflammation of your liver. So when you have when your liver's acting up, think about what your liver normally does, and then think about how it's going to work when it's not doing so well. So think about storage. Like your liver does so many things, like with clotting, just with like medications, just a lot of things. So think about storage. It stores different minerals and all your vitamins. It has different cells. So think about the different cells, what they do for like red blood cells, how they help with clotting cascade, metabolism. In the proteins one, it says like the breakdown. So if your liver's not working, it usually breaks down ammonia. So if you have high ammonia levels because it's not working, then you're going to be like confused. Sometimes you get that like uremic frost where it's like white and itchy. So just think about how if your liver is working, this is what it does when it's not working. It's not going to work. Think about that albumin, fibrogen, just the different things about clotting. It stores and releases the glucose, so your glucose is going to be abnormal, your insulin ratio, and then it breaks down different fats as well. So then I wrote to the side, I just have protein. The larger molecules won't be able to be filtered through the liver. It'll hold on to fluids in the vascular space. So you're going to want someone to be on a decreased protein diet, decreased albumin because albumin, protein, and then ascites. So you can just have like your really big liver. You're going to have decreased blood pressure, decreased cardiac output, and decreased perfusion. So what is hepatitis? It's inflammation of your liver. It can happen from viral or environmental. So viral or environmental. The viral kind can be like, your A, B, C, D, E, and she gets more into detail throughout the slides, but know about that. Then you can also have like Epstein-Barr. So like mono, I have like this thing. I have Epstein-Barr, which is like chronic mono. It's like you can never get it to really go away. My mom had it. She gave it to me. And so like when you're stressed, you get really tired really easily. So things like that, herpes, just all those different things can cause hepatitis. Chemicals, drugs. We all know people who use drugs or they drink a lot. Their liver's pretty shot. Herbal use. So, when you take medications, and we don't always ask, like what herbal like substances do you take? And if they're on some that interact adversely within the liver, it causes liver damage as well. So pathology. So when your liver becomes enlarged, and you're going to get that right upper quadrant pain. Left and right for me. So my left side is my tummy. So that's this side over here. And my right side is my liver. So just think about those. I don't know about you and I, if our lefts are right or the same, but it's okay. You're going to get pain from it. It's going to be really painful. It impairs the liver's function to do what it normally does with the detoxifying substances. It, stores and also alters like your vitamins, sugars, fats. That's where that glucose comes into. And then it can get necrotic and die. And then that's even worse. If it's not functioning properly, that's one thing. And your body's going to, react the way it reacts. But if it's necrotic, it's actually hurting everything else as well. So then your liver cells do not regenerate. Sometimes, you can get like liver transplants and they kind of regenerate. Once they're dead, they can't regenerate. So look at the bile ducts that lead from like your liver and connect into your intestines. That won't be working. It can't go to the appropriate places. You'll become jaundiced because of all that buildup. And then I just have written in here, because the bile can't go to the intestines, it'll build up and then it'll get into the skin, which makes that uremic frog get itchy. I have here like the sclera in your pee and your stool. You're going to see it everywhere. So then she talks about the different types of hepatitis. So there's A, B, C, D, and E. So when I think about A and E, so I know it's silly, but there's like a TV channel that's A and E. I think A and E go together, and then the rest go in a separate category. So A and E is like the food, or it can be like in dirty water, stuff like that. So A and E is like the TV show. They go together, and A, I eat an apple, A and E. And then the rest are all from, your blood, all those fun fluids. They all, I think, let me look. So all of them have a vaccine, but C does not. C is the most common type, probably because it doesn't have a vaccine. So C is most common, Hep C, a lot of people have it. It's like it's an epidemic in the world, and it's basically due because there's no vaccine for it. So think about third world countries, traveling, seafood, contaminated water, all of these things you can get hepatitis from. Sometimes hepatitis can be like reversible. It's from something, they treat it, and you get better. It's like C, you're going to have forever. You don't get to get rid of it. And if you're not safe, you can get it multiple times. So then classification. So there's 5 types, and then it just says like, recognize which kind it is. So if it's A through E, figure out what type it is, and then figure out how to treat it and what nursing interventions there are. So that's basically what I know you already had your test, and I apologize again, but recognize what type it is. So if it's A or E, you're going to know this is what type it is, this is how they got it, this is how you treat it, and these are my nursing interventions of how I'm going to treat it. So look at those. So type A, I wrote along the side here also like what basically I need to know for the test of these, because there's a lot of information in these little ones. So A, that's the RNA. You can get it from like the food or not intoxicated water, contaminated. You can get it from all those types. It reacts with the RNA. It says I'm not connected. I hope it's still working. Oh, I hope it's still working. Okay, and then I just put the onset here was 15 to 30 days. So just know it's going to be like flu symptoms, achy, tired. That's more type. Type B, you get it from all that extra fluid. That can be a little different, though. That's 25 to 180 days that you will see that onset. It's long-term, but most recover. I mean, long-term people recover. And that is with like treat it. I don't know the specific one. She just mentioned in my class that there was a chart of the meds of antiviral. So if she mentioned it, or if you know them, don't look it up. But if you don't know it, you could look it up. D and E are on the same slide for me. I'm not sure why, but D is from all the fluids. Its onset day is 14 to 56, and is really chronic. And then E is again with A, the food, water. You see a lot of this in third world countries. And then also it says you can't have D by itself. You always have it with E. So that's why they're on the same page. I'm not sure if E causes D. They're from there. You get them different ways though. So I just know that you can't have one without the other. And then I have here, she really told us that hepatitis E is really common with the immigrant groups. And so look when you like go places, when you travel, or when you eat foods that aren't from around here. So hepatitis C is the most common type. There's no vaccine. It works within your RNA. You're going to see it within 7 weeks. And there are individual therapies that they can try and like tailor to people. It's with that bloodborne groups. A lot of people who are addicted to drugs or use needles that like aren't sterile, they are common for Hep C. So if you work in the emergency department or basically on any floor, you could have someone that's addicted to drugs that uses needles. Just keep an eye out for that. There are 18 different medications, but they're all tailored to this person has it. They're this old. These are their other conditions, stuff like that. So there's it says 6 out of 100 infants. So if you have a mother that has Hep C, you could get it from that. And then just a lot of different, she just lists like needle sticks, sexually in contact with sexually active people, hemodialysis, because, I mean, let's be real. Do we really? We should. Don't get me wrong, we should, but during hemodialysis, there could be some contamination, which is horrible, and we should try and stop that in any way possible, but it can't happen. Most people do not have symptoms with Hep C. So even though it's an epidemic, so many people have Hep C, so many people more could have it. They don't know it because they don't have symptoms. But approximately 70 to 80 people don't have symptoms. They don't know they're infected. It can damage over decades. So I don't know I have this. I don't do anything about it because I don't know I have it. And then it really damages my liver. It is the silent killer. And I have a star next to that too. And then diagnosis. So think about your liver. What tests do you normally look at for your liver? And then you're going to look at those too, like your AST, ALT. Those will rise into the thousands. You can look at like your total bilirubin, ammonia, you're going to have high. Albumin, you're going to have low because, again, that protein. Look at your blood, like how your bleeding factors. You're not going to be able to break down that protein, you're not going to be able to break down that ammonia. That's why it's high, and then it causes the itching. And then I also have liver. Liver produces the albumin. So you're going to eat protein, it's going to be broken down, and then it's going to go into albumin, and albumin is what's made in the liver. So if your liver's not working, you're not going to have it. So everything is high except for albumin because that's what's made in your liver. Clinical manifestation. So you can have that right upper quadrant, abdominal pain, irritability, nausea, vomiting, loss of appetite, lethargy. That's because of your ammonia levels are increasing, dark urine. It really affects every body system. And then you can have that itching of the skin as well. So I have here the most common are the itching, a headache, the brain, the brain level of consciousness because you have too much ammonia. So then complications. So failure, these are just different terminology things that she had. So chronic hepatitis. So that is when it's longer than 6 months, and it can lead to liver cancer. It's not always like a precursor, like you're going to have cancer if you've had this but a lot of people develop cancer, liver cancer if they've had it for over 6 months. And then also just the toxins that build up in your bloodstream as well. And then she has the words on here. I can't pronounce them because we all know that. There's the hepatic encephalopathy. That's the one that builds up in the bloodstream like ammonia. And then chronic hepatitis. Those were the two terminology ones. So prevention. So wash your hands, wash off your foods before you eat them. Be very conscious about what you eat, like where you're drinking water from. In some places you can only drink bottled water. Know where you're at and know what you can get. Get your vaccines. Safe sex. And I mean, we all try not to get stuck by needles, but you know what I mean? Like, especially because we're nurses, we have this risk because we deal with needles all the time. And even though we know like, hey, this person has this in their past medical history, when you're going in and grabbing a blood work or grabbing, you're starting an IV and there's blood on that needle, it can happen. And so just be super, very careful. She did have a chart. It's 53 or 58.3 and 58.4, and it's on page 1205. And then she just has different interventions here. So you're going to want to rest the liver. So whatever its normal functions are, kind of do it for them. So their diet should be high in carbs and calories. It should be low in a lot of protein because they can't break down that albumin. Small, frequent meals. Drugs that are used that are digested in the liver, used sparingly. So sometimes they'll have certain drugs that are in the liver, and sometimes it'll be kidney. So you pick the kidney option. And then promote health regeneration. Again, I have to decide low protein, high carb, high calories, small, frequent meals. So high in everything except protein. Again, just like those tests that you're going to look for, they're all high except for albumin, because albumin is produced in the liver. Again, with this, everything's high except for protein. Protein should be low because they can't, you know what I mean? They can't break it down and turn into albumin. And then prevent complications. So just like just prevent complications. Just look at the way you can rest the liver. Try and not let it die. Don't get necrotic, because then you're looking at taking a part of the liver out, and it depends on what type. It's just so complicated. Just prevent all the complications you can. And then care. So you want to give them the option to have that the kidney do all the drug processing. I'm sorry, I can't talk today. You want the kidney to do all the drug interactions. You don't want the liver to. Treat hepatitis. Oh, sometimes they can get a liver transplant, and some people, okay, so I take it back, sorry. People who are healthy and then needed liver transplant can get a transplant from someone with hep, but then it can be treated afterwards. So there's always an option for like liver transplants. If you need a liver transplant and it's someone with hepatitis, they can still get it. And then it's up to the patient if they want to treat, they're going to want to treat the hepatitis, but it's up to the patient if they want to accept that liver. But it cannot be a blood or organ donor ever, is what it's written on the PowerPoint. But then off to the side, she said, like if this person really needs a liver and they're okay with just treating the hepatitis, why not try it? And then small, frequent, high carb meals. Again, she's just reiterating basically everything she's already said. Treat their symptoms. You can do like oatmeal baths to decrease that itchiness. So that's hepatitis. Think about your liver. Think about what it normally does. It's got a lot of functions over here. A lot of functions. So storage, production, metabolism. It metabolizes so many things. Think about what it does. Think about what you want it to do, how it's not working, the different types of hepatitis, and then like how you get them, how you treat them. And then no, Hep C is like the main most important one, and there's no vaccine for it. Okay, I will do pancreatitis next.